Yeah, so great question about terminology. So we're not using the term fully vaccinated. The definition of fully vaccinated hasn't changed. CDC is introducing a new term, up to date on all recommended vaccines, right? So if somebody has received 2 doses of the Moderna vaccine, for example, and they are more than 6 months beyond completing that primary series with the Moderna vaccine, and they're eligible and recommended for a booster to stay up to date on vaccinations, they need to get that booster dose. So there's potentially situations where somebody is exposed in the household setting. They've gotten their primary series, like 2 doses of Pfizer, 2 doses of Moderna. They're eligible for a booster, recommended for a booster, but haven't yet gotten it. Because they are not considered up to date on their COVID-19 vaccinations, they would still be needing to quarantine. So that is an important nuance and an important point within the new isolation and quarantine guidance. It's no longer about people who are quote unquote fully vaccinated. People need to be up to date on receiving all recommended COVID-19 vaccines in order to avoid quarantine if they're exposed in the household setting.
Dr. Chen, on the one hand, there's this recommendation to be wearing masks, if you test positive after the fact. But there are still some schools that don't have some of these mitigation measures in place. So, is this going to slow down if the schools aren't implementing some of these mitigation measures?
Is the pandemic going to slow down, or right?
Yeah, just in general, right? Cases among kids.
Yeah, so there's multiple factors that go into the pandemic trajectory, whether it's slowing down, whether it's going up. We're entering a very difficult period in the pandemic where we already have high levels of COVID-19. The last month or so, we've seen a low level of Omicron in New Hampshire, but we're starting to see increases in the number of infections due to Omicron. And so given what's happening in the rest of the country, where we're seeing this dramatic surge being driven by Omicron variant infections, we're likely, we believe, to see further increases in the already high level of COVID-19 we're seeing now. That's going to apply across the board in schools and businesses in our communities. And so I think it stresses the need for people to continue to take the necessary steps. Starts with vaccination, but we continue to recommend sort of a multi-layered prevention approach. Starts with vaccination. Certainly isolation and quarantine are important, but it still remains important for schools and other businesses to implement these prevention strategies, including face mask use. I can't speak to what's going to happen in individual specific schools. Each one has a different policy and a different way they've adapted the guidance. But certainly we continue to recommend sort of the multi-layered approach, including face mask use in indoor settings, including in schools. Thanks.